Hello, my name is Brett Burrows, and I'm a fourth-year PhD student at the University of Illinois at Urbana-Champaign. I work in the Renal and Cardiovascular Disease Research Lab under the direction of Dr. Ken Weiland. And I'm here to talk to you today about exercise and CKD and ways to help increase physical activity levels in your daily lives and how that can help improve your physical function and health-related quality of life. So I have no conflicts of interest. All the thoughts and opinions today are mine and mine only. Some discussion points today that I'm going to be talking about is physical inactivity and CKD and all stages of CKD, and kind of why physical inactivity is very much increasing disease risk in CKD, and then some common barriers that patients have that restrict physical activity, how to overcome these barriers, and then we'll be talking about some myths associated with exercise and CKD patients, whether it's CKD non-dialysis or dialysis, some benefits to physical activity for general population, but also specifically for CKD patients as well. Some recommendations for increasing physical activity and exercise in our daily lives, and then following up with some contradictions to physical activity. So there are some moments in time and some specific patients that should either not exercise at all or have just kind of safeguard their physical activity. And then lastly, I'll finish up with some frequently asked questions that I get, especially in the dialysis world, about exercise. So there are some terms that I just want to kind of go over to kind of clear up, because a lot of the terms when we talk about physical activity, exercise, physical fitness, they all are very closely related, but they are different as well. So sedentary activity is little or no physical activity, basically sitting, lying down for extended periods of time. Physical activity is anything that basically requires our bodies to move, muscle movement, to where we're burning some type of calories, whether it's a low amount or a high amount. So that can be anything from household chores, low levels of activity, leisure activities, walking the dog, gardening, shoveling snow, any of those types of activities, occupational activities that you do at may or do at work, higher level intensities, sports. All these activities are considered physical activity. To take it a step further, then, exercise is physical activity that is planned or structured and repetitive. So you plan to walk 20 minutes a day, 5 days a week. That's exercise. Physical fitness, then, is we're taking these physical activity and exercise and trying to hone certain skills so that we can improve our health through balance tests, gait speed, right? We do certain physical activities or exercises to improve balance. Then we do a balance test to see if those exercises are working and they're appropriate. And those balance tests are to help see if we're at reduced risk or high risk for falls, because we know falls are associated with hospitalizations and increased disability. So we do these tests to try to see where our weak spots are so that we can improve. All right, so CKD patients are extremely inactive. And this is CKD patients stage 1 through stage 5, non-dialysis, and also dialysis patients. So as you can see here in this, this table graph here, that as the red bars are inactive, as you progress through the stages of CKD, those red bars are obviously getting larger and larger. The kind of purplish bars here are the active levels. So, and they're obviously declining as we go through the levels of CKD. Kind of the only thing here, though, is in CKD 5, in stage 5, the dialysis patients are a little bit different here. They have a little bit dip in the inactive levels and a little rise in the active levels. That's because when we talk about activity or exercise programs, especially research related programs, they're predominantly in dialysis patients versus CKD non-dialysis. So that's why you see that kind of dip in the inactive levels and an increase in the active levels, just because there's some exercise programs for dialysis patients. But dialysis patients are the most inactive chronic illness population that we have. Dialysis patients actually report about 50% less physical activity than their healthy age-matched controls. So individuals of the same age, if they're healthy, report 50% more activity levels than somebody their same age that is on dialysis. So some results of sedentary activity. So this kind of picture here is a little confusing, so I'll try to go through it with you step by step here. But here in the middle, at the top, we have sedentary behavior. And this is affected by aging. So as we get older, we're more likely to be sedentary. Chronic disease, whether it's CKD, whether it's pulmonary diseases, whether it's cancers, all those increase your risk for being sedentary. And then dialysis as well increases your risk for being sedentary as well. So we'll kind of go to the left side here. So being sedentary increases your risk, or if you already have some of these risk factors, makes it worse. So increases risks or worsens of diabetes, hypertension, which those two kind of then kind of lead to increased risk for cardiovascular disease, depression, disability, and ultimately mortality. Death is increased risk with sedentary behavior. Going on to the right side of this picture here, things that are reduced, your physical fitness levels. So your breathing rate, things like that are reduced dramatically because of sedentary behavior. Your muscle mass is reduced. The word sarcopenia there is just a term that is, as we get older, we lose muscle mass, and that's just the progression of age is sarcopenia. So with CKD, that level is exacerbated with muscle mass. It's kind of more so than just the aging process. Physical function then is reduced as a result of muscle mass and physical fitness levels. Physical function's reduced. And if physical function's reduced, then we have a higher incidence of disability, right? Disability, quality of life is reduced. And then if you're increasing disability, reducing quality of life, that also increases your risk for mortality. But the good news is that exercise can kind of counteract these, some of these traits and mitigate them and help reduce these risks or improve muscle mass, muscle strength, and things like that. And I will talk about that later in the talk. Like I said, muscle mass, muscle loss leads to hospitalizations in CKD. This is shown on this graph here. As you see, so you have three lines here. You have this bolded line where this is going to be kind of normal aging process, normal levels of muscle mass through the aging process. These are individuals that are slightly active, but not active enough. So they're kind of losing muscle mass more readily than those just from getting older. And then those are severely inactive and are having a drastic reduction in muscle loss, have a drastic increase in hospitalizations compared to those with normal muscle mass. All right, so hospitalizations, increased risk for hospitalizations, increased risk for mortality, depression, and things like that. So trying to stay out of the hospital obviously is a good thing. Inactivity also decreases survival rates in dialysis patients. So this graph here is specifically for dialysis patients. This study back in 2013 looked at individuals that had a fair, low, and average amounts of physical activity. And I'll talk to you about kind of the guidelines of physical activity and what that means, but getting about 150 minutes of physical activity per week So those individuals on dialysis kind of had a reduction in survival, but certainly a lot greater survival than those that had very low levels of physical activity. So those individuals that had low levels of physical activity after about 1,400 days had about a 50% survival rate, compared to those that met or exceeded the guidelines had about just over a 75% survival rate. So drastic improvement in their survival by increasing their physical activity levels. So some primary reasons for inactivity in both CKD and dialysis. Well, first and foremost, there was a study in 2012 by Delgado and Johansson that specifically looked at counseling by the nephrologist. And the nephrologists lacked counseling skills to counsel their patients. So that is a big, reason why individuals aren't exercising, because they just aren't knowledgeable about different exercises to do, because the nephrologist is not speaking to them about it. Access to equipment and facilities, also another big one. We don't have access to gyms, possibly, especially for rural communities, right? Maybe you live in a unsafe neighborhood, so walking the streets is maybe not safe. So trying to get in activity that way is not easy. Lack of time, everybody has this issue, but certainly even more so for dialysis patients. They're spending 9 to 12 hours on dialysis a week. So trying to find ways to be active outside of the clinic is certainly burdensome. Fatigue, there's been data to show that fatigue increases with levels and stages of CKD, and especially for dialysis patients that have post-dialysis fatigue. This really can hamper their desire and want to be physically active. Comorbid disease, cardiovascular disease, diabetes, depression, all these factors can kind of restrict or make exercise more difficult. Lack of motivation, this is a big one. Again, all these kind of factors accumulating, then fatigue, lack of time, lack of knowledge, lack of access to facilities result in you're not being motivated to exercise. Also, a lot of individuals just don't think exercise is safe for them, especially for dialysis patients. They have access sites, the fistula on their arms, the catheters, and things like that. They just don't think that they're safe to exercise. And I'll talk about that later, how that is actually untrue, and exercise is safe for almost all patients. There are some patients where exercise isn't safe for, but they're usually kind of the rarity than the norm. So this is what kind of most patients think of exercise is, right? Most people. So heavy weights, running on a treadmill, using these funky exercise balls here, right? You're not sure how to use them right, what they, what they're used for. This picture here is some individuals doing some high intensity aerobic resistance exercise, CrossFit training, right? That's a kind of a popular term nowadays. So a lot of CKD patients, dialysis patients, they just don't think that they can do this type of exercise. But in fact, exercise can be anything that you can physically do, right? It can be, just a walk with your friend in the park. It can be, using light weights. You don't have to use heavy weights. You can exercise in your home. You don't have to exercise in a fancy gym or a rec center. If you're bound to a wheelchair or a walker, you can still do exercises. You just have to be a little bit, you're certainly limited in the exercises you can do, but you can still do exercises. And there's great benefits to these exercises too, even though that they're low level exercises. So overcoming these barriers. So like I talked about before, just the knowledge, a lot of individuals lack knowledge of appropriate exercises. And I said that physicians sometimes don't take the time to talk to us about these exercise guidelines. But if you do ask them specifically, they usually do take the time to talk to you about them. For a lot of individuals, if fatigue is an issue, you can start small. and just increase the amount and intensity of the physical activity as you can. I'll talk later about kind of, trying to get 150 minutes of physical activity in per week. A lot of individuals can't match that. So you need to start small and build on top of it. And then as we get acclimated to exercise, we actually start to see our energy levels improve and our fatigue reduced. So we can actually then do more and more. Lack of motivation, similar to fatigue, starts small. And don't try too much too soon. If you try too much too soon, you may, get sore, especially if you've never done any physical activity, any exercise before. You'll be sore. So if you do too much too soon, you're going to be very sore and you're not going to want to exercise anymore, right? Nobody wants to be too sore that they can't get out of bed. So start small and see successes and build off that. Schedule it into your day and start early. So make a schedule, put it on the calendar, and that something that you see each day. And I suggest doing it early in the morning because usually things come up in the day that kind of restrict you from being active. There's things that always kind of pop up throughout the day. So starting early to get it out of the way, make sure that you actually do it. Work out to music, or there's so many different podcasts out there nowadays on different topics. Many of them are free. Right now with the coronavirus, I know a lot also are either free or at a reduced cost. So try those out. It can make exercising just a little bit more fun, right? Some other kind of ways to kind of increase your motivation. They sound silly, but they do work. If you just lay out your clothes the night before, that actually does motivate you to be more active than in the mornings. If you're able to, buy a new pair of shoes or workout attire, this kind of gets you started. If you buy something new, you're going to want to use it, right? So that kind of just helps you get you over the hump and start moving. Also, too, if you can get a pedometer or some type of fitness tracker, there's so many different ones out there, different levels of cost, but that helps you, just again motivates you to track your activity. And then also, too, if you feel up to it, you can sign up for a race or a 5K, 10K, to kind of just motivate you as a competition, right? So that you can try to do your best. All right, so some myths about exercising. These are some things that I've heard of throughout my time in CKD and dialysis, and trying to explain to patients that these, while you may have heard of it, they're not necessarily true. Some of them come with some caveats, but they're not necessarily all 100% true. So exercise stress test is needed before starting an exercise program. That's wrong. It's a very conservative approach. Yes, if you have heart issues or have heart failure in the past, you should talk to your physician before starting some type of exercise program. But if you don't have any underlying heart issues, you haven't had previous heart failure, low to moderate intensity exercise is very safe. And in most cases, the risk of not exercising is always greater than the risk of being sedentary. Number two, CKD patients who are frail should not exercise. This is 100% wrong for the most part. Frail patients need to exercise maybe the most, because as I alluded to earlier, reduced levels of muscle mass and physical function are linked to falls, disease progression, decreased independence, so increased disability, right? Hospitalizations and deaths. So again, frail patients probably need exercise the most out of all the CKD patients. Number three, I can only lift more than 5 to 10 pounds with your access arm. So this is wrong. It only applies for a short time after surgery. Once that you become used to that fistula, your restriction of lifting 5 to 10 pounds is usually lifted after a few weeks to a month, depending upon how you're reacting to it. But after that period of time, you usually have that restriction lifted, and you can lift however you see fit. Dialysis patients shouldn't exercise while receiving treatment. This is very wrong. While it may be very limited to do exercises in the chair, and especially if you have one arm, receiving the treatment hooked up to the dialysis machine, you're obviously going to be very limited and restricted what you can do. But exercise is very safe if you can do it. I can only exercise during the first hour of dialysis treatment. Again, this is very wrong. There is no added risk for exercising in the third or fourth hour. Our lab actually did a study back in 2015 in which we looked at exercising in the first hour versus the third and fourth hour, and there are no changes in cardiovascular function at all. So this is wrong. The only time that this may cause some type of exacerbation of cramps would be if you have a history of low blood pressure during your treatment. So in that third and fourth hour, if you have a history of your blood pressure dropping, then maybe, yeah, you should probably exercise in that first hour. Or if you had a large interdialytic weight gain one time and you're taking a lot of extra fluid off, yes, you may have then low blood pressure in the third and fourth hour, and you may want to just exercise in that first hour just to play it safe. All right, so regular physical activity. So I want to stress regular. So these benefits that physical activity exercise have are from regular physical activity. So meaning that you're doing it 3, 4, 5 times a week for an extended period of time. So these benefits don't happen from 1 or 2 exercise sessions. So it helps reduce risk of cardiovascular disease, falls, right? We're increasing muscle mass, so that's helping us reduce our fall risk. If we're falling less, we're not going to the hospital as more. If we're not going to the hospital as more, then we have a reduction in disease progression and mortality. It also helps manage blood pressure and cholesterol, on top of the medications. Anxiety, stress, and depression all benefited from exercise. There's a limited amount of research on this topic, but pretty much across the board, exercise improves depression levels. Blood sugar levels for diabetes, it helps kind of mitigate the spikes and valleys in your blood sugar levels. So it kind of helps keep that in control. And then it also improves muscle strength, sleep. So after you're burning more calories, you're doing more activity, you're going to be a little bit more tired, right? And so it kind of helps with sleep. Also helps with our energy levels, reduces fatigue. Again, these are not from just 1 or 2 times of activity, but from sustained activity for multiple weeks. You're going to start to see your energy levels increase. Cognitive functions improved. And then for the dialysis patients, your dialysis efficiency is actually improved. So that exercise while you're on dialysis actually helps improve the toxins being removed out of your body, and actually is kind of less stressful on your body, so that you're less likely to cramp, you're less likely to be fatigued after your treatments. So all those consequences then help improve or maintain your independence and your quality of life. All right, so these are exercise recommendations that kind of the CDC and the American Heart Association kind of puts out there as far as kind of the guidelines. So I'll talk to you about how to kind of get these into your daily lives. But in general, aerobic cardiovascular exercise, you should be doing at least 5 days a week for about 30 minutes. Resistance exercise or muscular strengthening exercises 2 to 3 days a week, but not consecutive. So you shouldn't be doing Monday, Tuesday, Wednesday of resistance exercise. You need to break them up a little bit to give your muscles some time to recover. And you should be incorporating about 8 to 10 different exercises of a variety of upper and lower body muscles, if you can. If obviously you're some type of disability that restricts exercise in your lower legs, or you have amputation in your lower legs, then obviously do as much as you can. But if you can do upper and lower body exercises, that is definitely the best approach. And then you should be doing somewhere between 10 and 15 repetitions. And if you can't do that, just work up to that. If you can do 10 to 15 repetitions, take a break. And if you can do another set of 10 to 15, that's great. Some ways to kind of incorporate resistance is using body weight. Body weight is a great resistance for some people. using resistance bands or small hand weights as well. Flexibility or stretching exercises you should be doing, you can do pretty much every day of the week. If you just do it one day a week, you're really not seeing any benefits. So you should be doing it at least 2 times a week. Hold each stretch for about 10 to 30 seconds and repeat 3 or 4 times for each stretch. And if you're active doing certain exercises, you should try to stretch before and after the exercise. Balance exercise is similar. If you only do it 1 or 2 times a week, you're really not going to see any benefits in it. Kind of a waste of time. So you should try to do it at least 3 times a week to see those benefits. All right, so taking what I just talked to you about those recommendations and how to kind of put it into your everyday life. So like I said, 150 minutes of moderate physical activity is kind of what the guidelines suggest, which is basically 30 minutes a day for 5 days a week. And that can be either aerobic or resistance exercise or a combination. But if you're currently inactive, so you're not doing anything at all, work up to this. Don't, go from not doing anything to then next week trying to get in 150 minutes of physical activity. That might be too much too soon. You may be sore, tweak a muscle, injure yourself a little bit. So just try to work up to that. And I recommend increasing by about 10% per week. So if you can walk 20 minutes a day, then next week try to work to 22 minutes a day. Okay, so just work up to that 150 minutes. But try to be at least active by 3 to 5 days a week. So that doesn't necessarily mean exercise. That means, doing some gardening, doing some yard work, doing some household chores, just trying to get physically active in those 3 to 5 days a week. And you'll start to see yourself then improving, and then where you can try to, meet those minimum guidelines of 150 minutes. And then a lot of patients, especially on dialysis, they have very low levels of energy some days. Some days are just not good days, right? It is okay to skip a day of exercise if you're feeling very, very run down. But just don't let that, snowball and get out of control. One day can easily turn into 2 or 3. And then before you know it, it's been 2 weeks and you haven't exercised. So while, again, skipping one day is okay, just make sure that you try to get back to it the next day or so. All right, how to increase physical activity in your daily lives. So lifestyle physical activity. So these are usually low-level activities that we can do just to increase our steps, increase our physical activity throughout the day, and we don't even know it. So instead of taking the elevator, take the stairs. Some people, this may not be appropriate for if you can't do 1 flight of stairs. Don't try to do 5 flight of stairs. But if you can walk the stairs safely, and I would recommend doing that. It's an easy way to get some activity into your daily life. Again, if you're able to, park further away from the store or your destination and walk the rest of the way. Obviously, if you're handicapped, something like that, parking close to the store is certainly needed. If possible, walk or bike instead of driving. If there's a store within a short distance from you, again, instead of taking your car or a bus or something like that, try to bike or walk instead. During commercials, when you're watching TV at home, instead of just sitting there and watching the commercials, get up and walk around. Maybe try to do a lap around the kitchen and come back and sit down. That's doesn't take much effort or time, but it does increase those physical activity levels, and every little bit counts. Instead of going through a car wash your car by hand. Try new activities: dancing, gardening, tennis, biking, golf. Get creative with it. Whatever new activity that you want to try, that can help increase those physical activities throughout the day. Like I said, every little bit helps to kind of get to that 150 minutes per week. Excuse me. So other ways. So this is really good right now with the coronavirus. We can't get to gyms, even if you're able to, or you have gym access and you can't get to it because they're closed right now. Working out at our home is pretty much all we can do. So my recommendations for that is you want to try to establish some type of workout space. It doesn't have to be a a room dedicated to exercise. It just, one day lay out a towel or a yoga mat on the floor somewhere that you have enough room to do exercises and to space out, but just enough room for your body and some equipment if you have it. Again, you want to schedule your sessions. I talked about that earlier. Put it on your calendar, whether it's in the morning, whether it's in the afternoon, evening, whenever it is, put it on the calendar and make sure that you stick to it. I like to train in the morning because I always think things kind of come up in the middle of the day. So that's kind of the best time to train or to get some exercise in. But if you like to exercise in the evenings, that's fine too. Variety is definitely key. So it reduces boredom, right? If you do the exact same thing each and every day, you're going to get bored. Improvements are going to start to plateau. So try to switch it up. Don't do the exact same routine each and every day, each and every week. Switch it up a little bit, right? Again, upper lower body exercises is best. Finding a workout buddy, it helps keep you motivated, accountable. And this is kind of hard right now because of the coronavirus, working out with a friend, but you can do it, call your friend, text, email, use social media. Hey, did you exercise today? Just kind of, again, keeping everybody accountable and motivated. Some other alternative ways to increase physical activity, again, join a gym or a rec center if you can. Many have different classes designed specifically for beginners or older adults so that you can kind of ease into exercise, right? Dialysis patients can do light exercise while waiting in the waiting room. This is a really good time. Sometimes patients wait 5 minutes, some patients wait a half an hour, I've seen. So that's a good time to get some light exercises in the chair or beside a chair, doing balance exercises and things like that. So a really good opportunity to just increase your physical activity levels. This one is a little bit rare, but sometimes there is an opportunity to exercise while on dialysis for some patients. So if a clinic has exercise bikes or anything like that, bands, weights that you can use, I would suggest trying to utilize that for all the different reasons. But again, just that increases your number of minutes that you're active, and again, trying to reach that 150 minutes of activity a week. Finding a walking path or a biking path, walking inside of a mall, these are good ways to get some physical activity, but also kind of in a safe, in a way, right? Very low tripping hazards inside of a mall, not as many obstacles and things like that, no curbs to walk up. Same thing with a walking path, usually very flat for you. So try to get that. And then if you have a dog, try to take it for more walks instead of just letting Fido out in the backyard to go to the bathroom. Try to take it for a 10-15 minute walk if you can. So talked about a lot of different kind of standard exercises that we may know of. There are some non-traditional exercises that are just as good at improving some of our health and well-being, just as good as doing resistance exercises or going for 20 to 30 minute walks. So yoga, I'm sure a lot of you heard this. It's just a form of stretching and kind of an approach that's just kind of relaxing. Tai Chi is more for strengthening and balance exercises, but very good. And then something that we can all do is mindfulness training, pretty much in the comfort of our own home without any real practice or anything. There's so many apps out there if you have a smartphone that you can use. Calm is a great app. Headspace is another great app that you can use that will help with meditation, relaxation, right? These are all known to help reduce anxiety, stress, and depression. And then for CKD patients, all these also help improve blood pressure, resting heart rate, balance, and muscular strength as well. So very good kind of non-traditional exercise that we may not think of, but still very appropriate for seeing benefits. All right, so how do we measure intensity levels for physical activity? So we don't want to do too much, right? We don't want to kind of injure ourselves. So some ways to kind of gauge how hard or how slow we're going is just a simple talk test. So patients should be able to talk to each other, but not sing for moderate intensity exercise. So if you're going for a walk, you should be able to have a conversation with the person beside you. If you can't, then maybe you're just going a little bit too hard, right? And then for vigorous activity, so if you're going for a run, um, if you can hold on a conversation with somebody, you're probably not going hard enough. So patients should not be able to say more than a few words without getting out of breath for vigorous intensity exercise. So another way to measure our intensity is through heart rate. Moderate intensity exercise should be anywhere between 50 and 75% of your max heart rate. And then vigorous intensity exercise should be somewhere a little bit higher than that, 76 to about 95% your max heart rate. So if you're in those ranges, you're doing the appropriate amount of work. So if you're at 40% your max heart rate, you're not doing enough activity, intense activity, to see the benefits. That's why target heart rate is important. How we calculate max heart rate is a simple equation of 220 minus your age. So an example here, a 50-year-old individual, 220 minus 50. So the max heart rate is about 170. Again, this is an estimation. This isn't exactly your max heart rate. It's just a good, quick, easy estimation. So for somebody that's 50 years old, moderate level intensity exercise, their target heart rate should be between 85 and 128. So if your heart rate is at 70, then you're not going either hard enough or long enough to kind of get your heart rate up and seeing benefits in it. Similarly, if your goal is to do more vigorous activity and your heart rate is only at 120, you're not, again, getting that heart rate up enough to see the benefits of vigorous activity. So for a 50-year-old, vigorous activity would be target heart rate of 129 to 162. And last way to kind of gauge your intensity levels is what's called RPE, or rating of perceived exertion. So this scale here is a really nice, easy scale to kind of look at and gauge your activity levels. It just goes from 1 to 10, where 1 being very, very light, sleeping, sitting, watching TV, versus 10, maximal effort. You feel like you're going to pass out from exertion, from going so hard that you're out of breath. So obviously going somewhere in between that to kind of gauge your activity levels. So light activity, the 2 or 3, household chores, gardening, maybe things like that. 4 to 6, more moderate activity. So walking, maybe shoveling snow, raking leaves, things like that, to where breathing is a little bit more heavy, but you can still carry on a conversation. And you're still somewhat comfortable, but you can notice that your heart rate is increased, right? That you do notice that you're doing some activity. More vigorous activities, 7 to 8, to where you're starting to really get increased heart rate. 9 and 10, again, very hard max effort activity levels. So this is a really good, easy way to kind of gauge how hard you're going and to kind of tell, okay, do I need to go harder or do I need to back off with the exercise? All right, so some exercise guidelines to kind of keep us safe from, not getting injured, or just maintaining appropriate exercise guidelines here. So anytime we go out for, an exercise, bout of exercise, whether it's for walking, whether it's resistance exercise, running, biking, we want to warm up and cool down. Take 5 to 10 minutes of light stretching or light activity before and after. Again, that's going to be safe for your heart, improve blood flow for the activity, and kind of bring it back down to resting values after the activity. Take breaks if you need them, right? Don't try to push yourself too much, especially in the beginning parts of an exercise program. You may not know how much you can do, and so taking breaks is certainly okay. If you exercise outside, going for a walk outside, going for a run outside, morning, this is specifically when it's starting to get hot. Morning and evening exercise is the best. You want to avoid that kind of really hot, humid days in the middle of the day, because of heat exhaustion. Your excess sweating can be a problem. So try to avoid that really hot portion of the day. Wear light colored clothing and sweat wicking clothing if possible. It just helps pull sweat off your skin so that you have a reduced likelihood of heat exhaustion. And again, this is really hot days. Um, Also, exercising in the cold is okay. Certainly be cautious, be smart about it, but the best advice is just to layer clothing. Okay, you don't want to sweat too much and get your clothes wet and then cold, right? So layer clothes so that you can take them off so that you're not sweating so much that you make your clothes wet. Hydration is really important for everybody, right? So you want to hydrate before, during, and after. But for CKD patients, you really want to avoid these energy drinks that are out there. They're very common, and sports drinks, Gatorade, Powerade, those are usually very high in potassium and phosphorus. So avoid those. Just stick to water. But watch your fluid intake. Okay, don't guzzle the water down before, during, or after exercise, especially for dialysis patients, because you don't want to increase that interdialytic weight gain, right? So diabetics can and should exercise. Like I kind of alluded to earlier, regular exercise can help manage blood sugar levels, and it can actually lower your A1C as well. So before you exercise, though, make sure that your blood sugar levels are about 100 milligrams per deciliter. This is because when you exercise, your blood sugar levels will drop. This is going to vary on different person to different person, but it also varies on intensity and duration. The longer you go, the greater drop you are going to have in your blood sugar levels. So plan accordingly with your insulin and carbohydrates, and you need to adjust it accordingly as well. And the American Diabetes Association recommends a 15 to 15 rule. So, if your blood sugar levels are below 100, take 15 grams of carbohydrates, wait 15 minutes, and recheck your blood sugar levels. And if they're not at 100 yet, then do the 15-15 rule again until that your blood sugar levels are 100. So you want to make sure that you're checking your blood sugar levels often before, during, and after exercise. This is really important after exercise because hypoglycemia can occur long after exercise, up to 24 hours after you've done an exercise bout. You can still have a hypoglycemic event. So, this is really important for somebody that's not active and that becomes active. They just don't know how their body's reacting to the exercise. So make sure that you talk with your physician or your diabetes care team to make sure that you're not at high risk for hypoglycemia, and just some strategies on how to kind of reduce that risk. Again, the American Diabetes Association recommends the 15-15 rule, but again, talk to your physician on the best approaches that maybe for you individually. For dialysis patients, this is for really all CKD patients, but more so for dialysis patients with chronic volume overload. So why is chronic volume overload first and foremost is a problem? Because it increases blood pressure, right? If you have more volume or in your blood, you're going to have increased blood pressure. Also, if you have more volume overload, interdialytic weight gain between treatments, you're going to have to try to pull that fluid off more and faster, which leads to cramps and more amounts of post-dialysis fatigue. So how does this affect exercise? So chronic volume overload makes breathing very difficult for a lot of patients, right? And sometimes I've heard patients say that they feel like an elephant sitting on their chest. So if you feel like that and breathing is difficult, you're not going to be able to exercise appropriately and safely that day. Also, if you have a resting blood pressure that's very high, greater than 200 over 110, that's not safe to exercise at those levels. It can cause some adverse effects on your heart. Also, like I said, your chronic volume overload, you're more likely to pull off more fluid for that day. You're more likely to cramp. If you're cramping, you're going to have more post-dialysis fatigue, and you're not going to want to exercise if you're very fatigued. So how can you control chronic volume overload? So you just want to watch your dietary salt intake. Exercise and nutrition are very much linked, right? So we just want to watch the amount of dietary salt intake that we have. I'm not going to get too much into how nutrition and exercise are linked, but they are very much linked, and they, you you need to have an appropriate diet as well. So just watch that dietary salt, try to reduce the amount of, deli meats that we're eating, going out to eat, things like that. Wherever the salt is, we want to try to reduce that as much as possible. All right, so for individuals that are looking to get a transplant or maybe had a transplant, this exercise is very beneficial. So I know a lot of individuals trying to get on the transplant list. So being active can help with that, especially if you may need to lose weight or better physical function, things like that to get on the list. Exercise can help with that, right? But being active prior to a transplant helps reduce your hospital stay pre and post transplant. So it just kind of makes your stay a lot less. You're just going to recover faster from a transplant if you've been active for a period of time before your transplant. Don't try to be active the day before your transplant. That won't help. But a few months before your transplant, trying to get physically active will definitely help reduce your hospital stay. It also helps reduce muscle loss from some of your medications that you're taking. So post-transplant, you're going to be on immunosuppressant medications, and kind of a side effect of that is some increased muscle loss. So the exercise obviously helps kind of mitigate that and reduces the loss of muscle mass. And muscle loss is associated with poor survival post-transplant. So just another reason why exercise is very good for transplant patients. And exercise helps reduce fatigue, weight gain, and possible osteoporosis post-transplant. Again, a lot of those ailments are kind of from those immunosuppressant medications that we're taking, right? So again, exercise helps mitigate that. It also improves your cardiovascular fitness, quality of life, and mood. And then exercise is safe as early as 12 hours post-transplant. Though this should be and needs to be supervised by some type of physical therapist or kinesiotherapist. Somebody needs to supervise this, but you can be exercise and physically active up to about 12 hours post-transplant. All right, so for your home workouts, if you don't have any weights, it's not a problem. You just have to get a little creative with it. Okay, so how to make your own weights. So a good way that we tell a lot of our dialysis patients to is get a milk jug or a liter bottle, empty it out, clean it, and then fill it with some type of sand, rocks, concrete, if you really want something heavy. But just fill it to a desired level of weight, seal off the cap with duct tape, and that can be your weight. A very easy homemade weight to use. Some other alternatives to just kind of hand weights are resistance bands. Resistance bands are a great way to incorporate resistance exercises without kind of the cost associated with hand weights. Resistance bands are going to be a lot less cheaper, but I recommend the ones with handles on them. Just makes the exercises a lot more user-friendly and easier. And then soup cans can be used as well. So just try to get creative with it if you don't have home weights or hand weights, and you can still do those resistance exercises and see some benefits. All right, so we talked about all the benefits of exercise and things like that, what exercises to do, but now we want to try to talk about how to actually, stay motivated and see some type of improvement. And one way to do that is to set SMART goals. So SMART goals are specific, measurable, achievable, relevant, and some type of time frame. So again, these may sound silly to do, but they are proven to work and help meet your goal, whatever your goal is, meet it and exceed it. So specific. So you have to make this goal very, very specific. Okay. So not just, hey, I want to exercise more. Well, you're more likely to just say, forget it, I'm not going to exercise. If you make it very specific, you're more likely to actually do that and maybe even more. So be as specific as possible. So I want to exercise 30 minutes a day, 4 days a week. Okay. Write it down, put it somewhere where you see every day. in your bathroom mirror, on your refrigerator, so that you see it every single day. So it kind of reminds you to get active. Measurable. So you need to be able to measure it some way, somehow. For instance, so cardiovascular exercise, the number of steps that you take. If you have a pedometer, you're stepping, taking more steps each day, taking more steps each week, going for longer distances, right? Instead of going for a mile, now you're going for 2 miles. Instead of going for 1 block, you're going for 2 blocks. Time is a very easy one. You're walking for 5 minutes. Next week, walk for 10 minutes. Very easy ways to measure that. Weight loss, while I don't particularly like this way of measuring weight loss, is using a scale, it certainly is an easy way to measure your weight loss, if weight loss is appropriate. But I also like how your clothes fit. So are your jeans fitting a little less snug? Your shirt's fitting a less snug? That is one way to help measure your improvement in weight loss, not just a scale. Resistance exercise, improvements in your sets and repetitions, right? So you're doing more repetitions instead of doing 10, now you're doing 15. So that's an improvement. So you're able to measure that. Using weights versus using body weights, now you're using weights. So that's, again, one way to measure resistance exercise. Achievable. So this one's a tough one for some people, but you really want to try to challenge yourself, but you also want to make it realistic. Okay, if you are completely inactive and you've never done anything before, I would highly recommend not making the goal of a marathon. Start in the realm of possibility. Again, you want to challenge yourself, but make it realistic, something that you can accomplish. You don't want to set yourself up for failure. Relevant. Is it important to you? Find your reason why. This one is a big one because this one really can kind of push you over the hump and really kind of get you to meet this goal. I've talked with a lot of dialysis patients. They want to be more active. There's some individuals I've talked to for little things like, I just want to get rid of my walker, right? There was an individual that he wanted to walk his daughter down the aisle at her wedding in a year. So find your reason why you want to be active, and that will help you, motivate you on those bad days that you're going to have, because you are going to have some bad days, right? So that kind of helps you motivate yourself to stay active and stay on the plan, and so that you can meet your goal. It also has to be some type of timeline, right? You can't just say, I want to exercise and that's it. Okay, when do you want to meet this goal? I want to run a 5K in 3 months. I want to run, like I said, a gentleman wanted to walk his daughter down the aisle in a year. So you have to have that end goal of some type of timeline, right? A deadline to meet that goal. If you don't, you're just going to kind of spin your wheels a lot and really be less likely to meet your goal. All right, so like I said before, there are some types of patients, sometimes that exercise is not safe and that you do not want to exercise. So I'm just going to talk a little bit briefly about some of these times. So these first couple bullet points here are, if you experience any of these, do not start exercise. Or if you are in the middle of exercise, stop immediately. And you need to contact your doctor or physician if you're experiencing any of these symptoms, because they are severe. So anytime before or after or during exercise, if you have chest or jaw pain, especially if it's radiating pain down one of your arms, that's very much indicative of possibly having a heart attack. So do not exercise if you're having that these pains. Contact your physician right away. If you have a resting blood pressure of greater than 200 over 110, again, don't exercise that day. For whatever reason, stress levels are high, pushing that blood pressure up. Just take that day off, take your medication, and try to check it again the next day to see if it's lower than that. But you do not want to exercise when your blood pressure is that high. Same thing with resting heart rate. If your resting heart rate is above 120 beats per minute, that is definitely a sign that you do not want to exercise. If your resting blood pressure is below 200, 110, but then you start exercising and it shoots up to 220 over 105 during exercise, you want to stop immediately. Okay, again, these are indications of not starting or stopping immediately during exercise. Some just caution with some these next three bullet points are more for caution than really not exercising. So patients with hypertension, especially with high hypertension, you just want to be cautious with lifting heavy weights over your head. If you're lifting heavy weights over your head, and you just have a increased risk for your blood pressure to go up higher, right? So we just need to be cautious with that. Individuals on beta blockers for their blood pressure. So beta blockers can prevent a heart rate increase with exercise. So I talked earlier about target heart rates. So if you're on a beta blocker, these target heart rates are pretty much irrelevant for you because your heart rate will not increase past a certain point, no matter kind of how intense your exercise is. So just be cautious with that. Don't try to do too much. Don't say, oh, well, my heart rate is only at this level. I need to go harder to get my heart rate up. That's not true. If you're on a beta blocker, your heart rate won't go up past a certain point. So again, just be cautious. And again, diabetes, diabetics, we talked about this earlier, but just check your blood sugar levels often, right? Risk of hypoglycemia is elevated during and after exercise. All right, so finishing up here, some frequently asked questions that I've gotten through my years, and just kind of talk to you quick about them. Some of you may have the exact same questions. So kind of go through these. How do I know if I'm overdoing it? So we talked about some ways to kind of measure your intensity levels, but there are some other kind of really general ways to kind of measure or know if you're overdoing it. If after exercise you're too tired to do normal activities, so if you normally can, vacuum and do some household chores, if you're too tired to do that afterwards, you probably went a little too hard or a little too far and you overdid it somehow. If you're uncomfortably short, out of breath, or very tired during exercise, you need to slow down or take a rest. Okay, it's perfectly fine with taking a break and stopping. Don't push yourself too much. Try to just know your body and listen to your body. Last slide, we talked about, obviously, if you're dizzy or have chest pain, jaw pain, or some type of unexplained swelling, stop immediately, contact your doctor. So I need to gain weight, but exercise will make me lose weight. Should I exercise? Yes. Yes, you can still exercise, and yes, exercise does help with weight loss. But if you do resistance exercise, you can actually increase muscle mass, which actually will help with weight gain, and then also help with your appetite. It will increase your appetite, which that will also help with weight gain as well. So I use a walker. I should not exercise without it, but I want to push myself. So no, you shouldn't exercise without your walker. Okay, your walker is there to prevent a fall. While it may restrict you a little bit, it's there more of a safety precaution than anything. I want patients to push themselves, but I also want it to be safe. So make sure that you're using your walker when you need to, right? And hopefully by doing certain exercises, you may be able to get rid of that walker if you feel confident enough. Although I do tell patients that some patients may always need their walker. So don't feel discouraged if doing an exercise program, you still have to use a walker. Again, it's there for your safety so you don't fall, because falls can lead to fractures, hospitalizations. So we just want to be as safe as possible. So I'm in a wheelchair. Can I still exercise? Yes. Although being in a wheelchair certainly is limited. You have certain limitations with the exercises that you can do. If you have some type of disability in your legs, an amputee in your legs, just focus on upper body resistance exercise to help build muscle strength that way. But you still can be active even in a wheelchair. So I have lots of swelling in my legs, and my doctor told me to stay off my feet. Certainly listen to your doctor, but balance physical activity with elevating your feet. So walking helps. Walking helps with a muscle pump to help pump that fluid back into circulation. also elevating your feet helps reduce swelling. So both are very good with swelling in your legs. Again, always listen to your doctor, but you can balance both of them. Talk with your doctor to make sure it's safe, but it should be okay if swelling is your only issue. I have no energy. I shouldn't. I should conserve my energy, right? So no, this isn't necessarily true. So you don't want to just conserve your exercise or your energy. Um, Exercise will help build endurance and improve energy levels. I talked about it before. Being sedentary is a greater risk than um, being active. Okay. So even though you may have low levels of energy and you don't want to do anything, doing something, even though it's little, is going to be helpful in the long run. Do it more and more and more, and you'll start to see those energy levels improve little bit by little bit by little bit. And then before you know it, you can, do a lot more than what you thought you could. So just because you have low levels of energy doesn't mean that you shouldn't exercise. All right, so what type of exercise is best for patients on CKD? So whatever exercise or activity you like to do, and whatever gets you off the couch and moving the most. We in our lab, we like to talk about less sitting, more moving. All right, again, I alluded to it just before this slide. We want to increase the amount of physical activity, even if it's low level physical activity, even if it's walking to the mailbox and back multiple times. Okay, it doesn't have to be long duration activities or high intensity activities. It can be very low level activities. Dust your house more, vacuum a little bit more, do a little bit more gardening, right? It can be very low lifestyle physical activity. Exercises can make a big difference if you do it for an extended period of time and as far as months or weeks. But do what you like to do. You're not going to stick to an exercise program if it's something that you don't like. So if you don't like it, don't do it. Do something that you want to do and you'd like to do. All right, so in summary, like I said, increasing stage of CKD and age leads to a reduction in physical activity levels. That's pretty much straight across the board. Like I said, the only reason that some of the dialysis patients have improvements is in activity levels is just because those individuals are more prominently on exercise programs than non-dialysis CKD, but they still are the most inactive population in chronic disease populations. Increasing physical activity to reduce risk of cardiovascular disease, falls, disability, disease progression, hospitalizations, and death. So those are definitely the important parts of why we want to be physically active. Incorporating physical activity and exercise in our daily lives is not hard. We just need to motivate ourselves, right? We need to find that reason why. Why do we want to be active? For some individuals with have a disability, maybe it is hard, but you can still find very little ways to incorporate physical activity into our lives that really is not that difficult. We just need to find ways to to kind of get around those disabilities and just be a little bit, some alternative exercises, whether it's, if you can't be physically active, then maybe mindfulness meditation is appropriate for you, and you still can see some benefits. All types of physical activity and exercise are beneficial and is safe for almost all patients. Like I said, there are some patients that have underlying heart disease or history of heart failure to where it may not be appropriate for, but pretty much everybody else, exercise and physical activity in low to moderate intensity levels is very safe. But again, what I want to stress is do what you like and make it fun, right? You're not going to want to do something long term if you hate it. So if you don't like to, go out for walks, don't go out for walks. Try to do some more gardening. If you don't have a garden, try to find a bike path and go biking. If you don't like any of those, tennis, golf, anything that you can do that you like, do more of it. Try to make it fun. Listen to music while you do it. Try to do it with a partner, a friend, your husband, your wife. Whatever the case is, try to make it as fun as you can so that you stick to it, right? All these exercises and physical activity benefits are great, but they're only there as if you do it. So if you drop out of your exercise program, you're not going to see the benefits of the exercise. Here are some, last thing, here are some resources that you can also go to. So the ACSM has a really good walking program on how to start a walking program, kind of from the low levels to all the way up, to making it a little bit more difficult. So really good guide on how to kind of start a walking program. A falls prevention program as well, for individuals that, where balance and falls is an issue. Really good program there to look at certain exercises that really focus on balance. This Can Restore program. This is a program out of Alberta, Canada, specifically for transplant patients. So if you're looking to get a transplant or had a transplant recently, this is really good, some resources to go to. The last two, while they're more for dialysis patients, they're really for anybody through CKD. The MOVE project in UK and the Life Options, they are, like I said, more predominantly created for dialysis patients, but really anybody on CKD can benefit from them. All right, so I just wanted to say thank you for listening. Hopefully I gave you some information that was useful for you. And I sent out a packet of exercises. Hopefully the board will send those to you. And certainly if you have any questions, I'll be available for that expert panel on April 16th. So I look forward to hearing any questions that you have. Certainly write them down. And I'll look forward to seeing you or listening to you on April 16th. So thank you very much, and bye-bye.